I am Jaira Sinina Matirable from BSN1 RM, your future nurse. So today, I will discussing the theory of cultural care, diversity, and universality developed by Dr. Madeleine Leininger. So first, who is Dr. Madeleine Leininger? So Dr. Madeleine Leininger is a pioneer in nursing and also an anthropology. She is born on July 13, 1925 on Soton, Nebraska. 1948, she studied at St. Anthony's School of Nursing for a nursing diploma. 1950, Benedictine College. In 1954, she entered the Catholic University of America in Washington. 1966, the University of Washington. She claimed her PhD in Cultural and Social Anthropology. 1969 to 1974, she is a Dean and Professor of Nursing at University of Washington. In 1974 to 1981, she is a Dean Professor of the Nursing at Anthropology University of Utah. In 1995, Clinical Professor of Nursing at the University of Nebraska. And she died on August 10, 2012. She is the middle child of 5. She had 2 older sisters and 2 younger brothers. And she is graduated at Houghton High School in 1942. What I said. The awards and achievements of Dr. Lieningier. 1948, she graduated from St. Anthony with a diploma in nursing. 1950, she earned a bachelor's degree from Mount St. Scholastica College in Atchison. 1951 to 1954, she studied biology, nursing administration, curriculum, and teaching at Creighton University in Omaha, Nebraska. She earned the equivalent of Bachelor's of Science in Nursing or BSN, received her Master of Science in Nursing MSN in 1954. In 1974 to 1981, she held various positions at the University of Utah, including Dean and Professor of Nursing, Professor of Anthropology, and Director of the Center for Nursing Research and the Doctoral and Transcultural Nursing Programs. Established the Transcultural Nursing Society 1981 to 1995. She was a Professor of Nursing, Professor of Anthropology, and Director of Transcultural Nursing Program at the Center of Health Research. In 1995, she is semi-retired. She was still very active in teaching and promoting her work. Other awards: Professor Emeritus at Wayne State University, Professor Emeritus at the University of Nebraska School of Nursing. She also was awarded honorary degree from Benedictine College, the University of Indianapolis, and the University of Kuopio, Finland. She also was a Fellow of the American Academy of Nursing, a Distinguished Fellow of a Royal College of Nursing in Australia. In 1998, she was named as a living legend by the American Academy of Nursing. The Transcultural Nursing Theory. Transcultural Nursing Theory, the theory or culture care theory by Madeleine Leininger, involves knowing and understanding different culture with respect to nursing and health illness carrying practices, belief, and values with the goal to provide meaningful and efficacious nursing care. The goal to provide meaningful and efficacious nursing care, service to people according to their cultural values and health illness context. Content: the main focus of Leininger's theory is for the nursing care to fit with or have beneficial meaning and health outcomes for people of different or similar cultural backgrounds. In 1995, Madeleine Leininger defined transcultural nursing as a substantive area of the study and practice focused on comparative cultural care or caring values, beliefs, and practices of individuals or groups of similar or different cultures with the goal of providing culture-specific and universal nursing care. Practices in promoting health or well-being or to help people to face unfavorable human condition, illness, or death in culturally meaningful ways. The main focus of Leininger's theory is for nursing care to fit with or have beneficial meaning and to health outcomes of people with different similar backgrounds. So next, the major components of the theory. Transcultural nursing, defined as a learned subfield or branch of nursing which focuses upon the comparative study and analysis of cultures with respect to nursing and health illness caring practices, beliefs, and values with a goal to provide meaningful and efficacious nursing care services to people according to their cultural values and health illness context. Then, in the ethno-nursing, the study of nursing care beliefs, values, and the practice of cognitively perceived and known by a designated culture through their direct experience, belief, and value system, Lieningier 1975. Nursing, defined as a learned humanistic and scientific profession and discipline which is focused on human care, phenomena, and activities in order to assist, support, facilitate, and or enable individuals or group to maintain or regain their well-being or health in culturally meaningful and beneficial ways or to help people face handicap or death. And professional nursing care or caring, defined as a formal and cognitively learned professional care knowledge and practice skills obtained through educational institutions that are used to provide assistive, supportive, enabling, or facilitative acts to or for another individual or group in order to improve a human health condition or well-being, disability, lifeway, or to work with dying clients. In cultural congruent nursing care, defined as those cognitively based assessive, supportive, facilitative, or enabling acts or decisions that are tailor-made to fit with individual, group, and institutional cultural values, beliefs, and lifeways in order to provide support, meaningful, beneficial, and satisfying healthcare or well-being services. And lastly, the health is a state of well-being that is culturally defined, values, and practice, and which reflects the ability of individuals or groups to perform their daily rule activities in culturally expressed beneficial and patterned life ways. Cultural and social structural dimensions, defined as involving the dynamic patterns of and features of interrelated structural and organizational factors of a particular culture, subculture, or society, which includes religious, kinship, social, political, and legal, economic, educational, technological, and cultural values, ethnohistorical factors, and how these factors may interrelated and function to influence human behavior in different environment contexts. Next is environment context. It's the totality of an event, situation, or particular experience that give meaning to human expressions, interpretation, and social interaction, in particular physical, ecological, socio-political, and or cultural setting. The culture is the learned, shared, and transmitted values, belief, norms, and lifeway or particular group that guide their thinking, decisions, and actions in patterned ways. Human beings, such are believed to be caring and to be capable of being concerned about the needs, well-being, and survival of for others. Lieningier also indicates that nursing as a caring science should focus beyond traditional nurse-patient interaction and dyads to include families, groups, communities, total cultures, and institutions. Next is the society and environment. These terms are not defined by Lieningier. She speaks instead of worldview, social structure, and environmental context. Lastly is the worldview. Worldview is the way in which people look at the world or at the universe and form picture or value stance about the world and their lives. So there are four meta-paradigm concept of nursing. First is the person, who the one is the recipient of care. Second is the nursing, the nurse action, and the third is the health, which is state of well-being defined by the person. And lastly, the environment, the internal and external factors. In the Lieiningier's meta-paradigm, humans are universally caring beings who survive in a diversity of cultures through their ability to provide universality of care in a variety of ways according to differing culture, needs, and setting. Nursing Theories 2012. So, in the environment included events with meanings and interpretations given to them, in particular, physical, ecological, socio-political, or cultural setting existing forced outside the organisms in the context of culture based on Nursing Theories 2012. So that's all. Thank you for listening and good luck, future RN.